So in this Pharmac daily revision, we'll be highlighting on these three topics, that is anticholinergics, tocolytics, and also Cotrimoxazole. So by the end of this video, I can assure you that you will be knowing a few points on anticholinergics, tocolytics, and also Cotrimoxazole. So firstly, let's get started with anticholinergics. So anticholinergics are divided into antimuscarinic and antinicotinic agents. Antinicotinic agents are further divided into ganglionic blockers and also neuromuscular blockers. So moving to antimuscarinic agents. So antimuscarinic agents, here the drugs such as acetylcholine agonist, they act on muscarinic receptors, and drugs such as atropine and scopolamine act as antagonists and prevent the action. And moving on to the classification of anti-muscarinic agent. So here there are natural, semi-synthetic and synthetic agents. So under natural alkaloids, there are atropine, scopolamine, and under semi-synthetic derivatives, there's iosine butyl bromide, homatropine, and also ipratropium bromide and tiotropium bromide. And under synthetic antimuscarinic agents, in mydriatics there is cyclopentolate and also tropicamide, and in peptic ulcer there is pirenzepine, telenzepine, clidinium, and propanthelene. And as an antispasmodic, the drugs used are dicyclomine, valithamate, flavoxate, oxybutynin, tolterodine, and darifenacin. And also it can be used as a pre-anesthetic medication. So as a pre-anesthetic medication, glycopyrrolate is used. And also in case of Parkinsonism, benzhexol, benztropine, bipyridine, procyclidine are used. Now I'll be highlighting on atropine. It is an important drug. So we'll be looking at the action at various sites. So in case of GI tract, it decreases the tone and decreases the motility of the gut and relieves spasm, and increases the sphincter tone, that is constipation. And coming to the urinary tract, it decreases the tone of detrusor muscle and also increases the tone of trigone and sphincter, that is, it causes urinary retention. And coming to the RS, it relaxes the bronchial smooth muscle but also dries up all the secretions. Moving on to the eye, results in passive mydriasis, cyclopegia, and also loss of light reflex. And coming to the CVS, there's initial bradycardia with low doses, and also tachycardia is present. In case of CNS, it controls tremor and rigidity of Parkinsonism. And coming to the exocrine glands, the secretion is reduced. Now, moving on to the therapeutic uses of atropine and its substitutes. In ophthalmic use, it can be used as mydriatic and cycloplegic, and also as in iridocyclitis. It is used in pre-anesthetic medication to prevent vagal bradycardia and also to prevent laryngospasm by decreasing respiratory secretions. It is also used in sialorrhea, COPD, and bronchial asthma. Can also be used as antispasmodic in dysmenorrhea, intestinal and renal colic, and also in urinary disorders and in poisoning, that is OP poisoning. As a vagolytic, it can be used, that is to treat sinus bradycardia and also partial heart block due to increased vagal activity, and in Parkinsonism. Moving on to the adverse effects. In the GI tract, it can cause dryness of mouth, throat, and also difficulty in swallowing and constipation. In the eye, it results in photophobia, headache, blurring of vision, and coming to the urinary tract, there can be difficulty in micturition and urinary retention, especially in elderly men who have a known case of enlarged prostate. And coming to CNS, it produces restlessness, excitement, delirium, and hallucination. And moving to CVS, it can result in tachycardia, palpitation, and hypotension, and also results in acute belladonna poisoning. So, here it is more common in children, and the presenting features are mainly fever, dry and flushed skin, photophobia, blurring of vision, difficulty in micturition, restlessness, excitement, confusion, hallucination, and also disorientation. And severe poisoning can result in respiratory depression, cardiovascular collapse, convulsions, coma, and also death. And in case of a belladonna poisoning, how can we treat? So, first is to hospitalize. Second is by gastric lavage with tannic acid in case of ingested poisoning, and also tepid sponging to control hyperpyrexia, and diazepam to control convulsions. And also, in case the antidote for severe poisoning, physostigmine can be used. Moving on to some of the drug interactions, the H1 blockers, TCAs, that is tricyclic antidepressants, and also phenothiazines, they have atropine like action and may potentiate the anticholinergic side effects. Moving to the second topic, we'll be discussing on tocolytics. So, tocolytics are nothing but the drugs that inhibit the uterine contractions. So, they include beta adrenergic agonist, calcium channel blockers, atosebam, that is oxytocin receptor antagonist, prostaglandin synthesis inhibitors, and also magnesium sulfate, progesterone, and nitric oxide donors. So the mechanism of action is that there is the beta agonist, nitrous oxide donors, atosebam, indomethacin, all these drugs, and also the calcium channel blockers. So these drugs, they increase the CAMP and also increase the CGMP of the myometrium. So ultimately it results in inhibition of uterine contractions. So moving on to the uses, why are these used? So it is used to delay preterm labor, it is used in threatened abortion, and used in dysmenorrhea. Moving on to the final topic, that is cotrimoxazole. So cotrimoxazole is nothing but a WHO approved or fixed dose combination of sulfamethasolone and trimethoprim, and this is of the ratio 5:1. So moving on to the mechanism of action, the PABA is converted to DHFA and it is converted to THFA. So sulfamethasolone is used in conversion of, it inhibits the conversion of PABA to DHFA by blocking the folate synthase and or inhibiting the folate synthase. And trimethoprim, it hinders the conversion of DHFA to THFA by inhibiting the dihydrofolate reductase. Now moving on to the why this combination is important. So in case of this combination, it acts as a bactericidal effect, but when given individually, it only acts as a bacteriostatic effect, and chances of development of bacterial resistance is also reduced when these two combinations are made. Moving on to the pharmacokinetics, they are well observed orally, and it can also be used in parenteral use. It is distributed in various tissues like CSF, sputum, metabolized in the liver, and excretion is mainly in urine. Moving on to the adverse effects, it results in skin rashes, gastrointestinal disturbance, exfoliative dermatitis, erythema multiforme, Steven Johnson syndrome can also be present. And GI symptoms, it includes nausea, vomiting, glossitis, stomatitis, and megaloblastic anemia due to folate deficiency may also occur, mostly in alcoholics and malnutrition, and also results in bone marrow suppression with leukopenia, neutropenia, and thrombocytopenia, and it is contraindicated in pregnancy. Therapeutic uses of cotrimoxazole, it can be used in urinary tract infection, respiratory tract infection, bactericidal diarrheas, pneumocystitis jirovecii infection, nocardiosis, chancroid, and also typhoid fever. Thank you. That's it. Three topics. Hope you have understood the three topics. And on frequent revision, all these will be very easy to memorize. Thank you.